say a word about how it is that I'm here today talking about a Buddhist approach to psychoanalytic or psychological trauma. I'm an ordained Methodist minister, and for the first 50 years of my life, I really knew no other religion than Christianity. I was raised in the church, was pastor of a church for 3 years, and continued to attend church after becoming a pastoral psychotherapist more than 40 years ago. Then in 1995, my wife, who was working for the Ethical Culture Society, met Reverend Chung Lee, who was then minister of the Won Buddhist Temple in Manhattan, at a religious conference in Chicago, and Reverend Lee subsequently invited her and me to the first anniversary of the Won Buddhist Temple in 1995. I'd always been a bit interested in Eastern religion, and particularly Buddhism. When I was a junior at Pomona College in the 1950s, I was fortunate to attend a small luncheon with Alan Watts, who wrote about Zen Buddhism in the 1950s. And he turned me on to the writings of D.T. Suzuki, who at that time was in residence at the Claremont Colleges. At the same time, I began to be drawn to the writings of C.G. Jung and found his work to be very compatible with what I was studying and learning about Zen. In the 80s and 90s, I found myself feeling less and less comfortable with the Christian services I'd been attending. So when that invitation came 24 years ago from Reverend Lee, I was ready for a change, and I was so taken with the Dharma service at the temple that day that I began attending regularly and have continued to for the last 24 years. The chanting, the quiet meditation, the message about finding one's center, not just in search of enlightenment, but also in order to cultivate one's nature to become a more compassionate person and responsible member of society. And that's a very strong emphasis in Won Buddhism, to be a responsible member of society. That's why we become centered. This appealed to me greatly. So I continued attending the temple. I was given a Dharma name, Wan Jun Shem, which I was very grateful to receive, and which means roughly the one who seeks the middle path of balance. And today I am a lay teacher at the Won Buddhist Temple. I have not forsaken Christianity. I still value my Methodist ordination, but I see myself as a Christian Buddhist, which Buddhists have no problem with. Some Methodists may have more. And my theology, as I've gotten older, has become much more universal and inclusive than it was before I discovered Buddhism. Now, I share this because Buddhism, and especially Won Buddhism, has been a major factor in my life the past 25 years, and it has definitely affected my work as a psychotherapist. I still consider myself very much a novice in terms of understanding Buddhist thought and integrating Buddhist practice in my life, but it's played a major role in shaping my view of the world and certainly my work at PSI. So let me tell you how I think this has informed my work, and especially with those who suffer from trauma. As Julia Christeller mentioned in her presentation last month, after 9/11, all of us at PSI became very much involved in working with people who've been traumatized by that awful day, that awful event. Working with people who suffered from trauma was not new to any of us, but because the World Trade Center disaster was so close to us, literally 100 yards south of our major office at Trinity Place, it left many of us also traumatized by what we saw, heard, and felt that day. This presented a challenge for me, and I'm sure for many others on our staff, who were working with survivors of that disaster, because our own trauma could easily be activated by what we were seeing and hearing from our clients. We all know that by its very nature, trauma is full of emotion and energy, which can make the air in the room feel like it's so thick you could cut it with a knife. That was the way it often felt in those months following 9/11. And I think one of the things we learned very early in our training as therapists is the importance of containment, of being able to contain our own feelings and remain calm and centered when hearing the traumatic experiences of our clients. When dealing with people who have experienced serious trauma, it's not just a question of dealing with our counter-transference, but also of sometimes experiencing secondary trauma. You, the therapist, being traumatized by the awful experiences you're witnessing through the eyes of your clients. So let me say that, I do not think this is totally a bad thing. If I prize my objectivity and ability to contain my feelings in a therapeutic session, I also value my ability to empathize with those who seek my help. Feeling some of their pain can make me more effective in understanding them and connecting with them. I think we could all agree with that. I don't want to be a blank slate. I don't want to totally shut off my feelings when witnessing somebody else's trauma. But I do want to be able to be a stable container both for my own feelings and those of my clients. If they feel that I'm a compassionate container for their feelings as well as my own, this can be a major source in healing and releasing those feelings. And here is where Buddhist practice has been particularly helpful to me. At the core of Buddhist practice, of course, is meditation. Sitting quietly, breathing slowly and deeply, while emptying one's mind of all thoughts and distractions. Sotae-san, who was the first Grand Master and founder of Korean Won Buddhism, describes it as follows. The method of practicing this form of meditation is so simple and easy that anyone can practice it. I'm not sure it's simple and easy. Sit on a cushion in a relaxed posture with the legs folded. Keep the head erect and the back straight. Make the lower abdomen the center of control for the bodily energy. Empty of thought. And always be sure that the center for moderating the bodily energy is located there in the abdomen. When the mind becomes distracted and the power of concentration weakened, try again to control the energy. Keep the spirit tranquil, and through its tranquility, keep the spirit clearly awake. Sotae-san suggests that through the daily repetition of this practice, one can develop what he called spiritual stability. He writes, quote, "Spiritual stability means the mental state in which the mind is of roundness, clear and calm, such that it entertains neither a sense of discrimination nor attachment. One extinguishes the sense of discrimination and attachment within, and the mind is not outwardly attached to disturbances, so that one fosters a clear and calm spirit." He adds, if one examines the cultivation of spiritual stability for a long time, the spiritual power can become as firm as iron and rock, so that the power of independence of mind will be consolidated through all kinds of trying situations, and will gain at last the power of cultivation. Now, those of you who have meditated, I'm sure many of you have, know that while this sounds very simple, it's anything but simple. Being able to empty the mind of thoughts is a very difficult thing to achieve. And even the most practiced meditators will tell you that they can rarely achieve a total emptying of the mind without distraction. When one of his followers asked the Buddha, how long does it take to achieve total clarity of mind and enlightenment? The Buddha answered, 10,000 lifetimes. However, being aware of the difficulties involved and hopefully accepting one's own limitations, I think those who practice meditation generally find it very helpful and very calming. Medical tests have shown that meditation lowers the blood pressure, slows the pulse, and slows down the activity within the brain, lessening stress and increasing the sense of calmness. Now, I certainly do not consider myself to be a very practiced meditator. Nonetheless, what I've learned by practicing meditation as well as I can is that this has given me tools that are extremely helpful to me as a therapist. For me, the most helpful part of that is the breathing. When I'm sitting with a client in a session and their anxiety is so high that it penetrates whatever defenses I have to try to avoid contamination, and let's face it, anxiety is contagious. I will consciously start to breathe the slow, deep breaths that I have learned from meditating. And this definitely helps me to remain calm and contain my own feelings in the therapeutic session. The beautiful thing is that the body remembers. This is something somatic therapies have been telling us more recently. When I was a student at Blanton Peel in the early 1970s, I remember a presentation by someone who practiced neuro-linguistic programming, who pointed out that we can use bodily cues to induce physical states that we have experienced. For example, when I meditate, I place the thumb and middle finger of each hand together and then on my lap while I meditate. So when I find myself in a particularly stressful situation and begin to breathe the way I do when meditating and place my fingers together that way, my body, having been cued by the breathing and the fingers, will tend to remember and go into a relaxed meditative state. This will not make me less attentive to my client. On the contrary, I think it allows me a greater clarity of mind and will diminish the desire to escape the feelings of anxiety that threaten to penetrate my defenses. By no means do I claim to be successful at achieving this every time I'm confronted with strong anxious feelings generated by the trauma of my clients. But I think it's proven to be a very helpful tool to me in many instances, and I'm very grateful for having developed this through Buddhist meditative practice and what I've learned at the One Buddhist Temple. I find that the same practice also informs some of my interventions with anxious or traumatized clients. I can gently urge them to stop and breathe, sharing with them some of the methods I've learned in doing this. And on some occasions, I've sat and meditated with clients, being very careful to choose those moments when I perceive that they have adequate ego strength to do this without increasing their anxiety. Another aspect of Buddhist thought and practice which has been very helpful to me in my therapy is the importance of being able to develop an observing ego, which can separate itself from what one is feeling and thereby objectify the feeling and not feel overwhelmed by it. The ability to do this is one of the byproducts of meditative practice. As the mind becomes clearer and calmer, it feels less overwhelmed by negative or unwelcome feelings. The Vietnamese monk Thich Nhat Hanh describes this beautifully in his book, Pieces Every Step. If you only read one book in your lifetime about Buddhism, I urge you to read this one, Peace is Every Step, Thich Nhat Hanh. I want to share some of what he says about developing the capacity to observe your feelings without being overwhelmed by them through meditation and mindfulness. He writes, "Our feelings play a very important part in directing all of our thoughts and actions. In us there is a river of feelings, and each feeling relies on all the others for its existence. To observe it, we just sit on the bank of the river and identify each feeling as it surfaces, flows by, and disappears. When we have an unpleasant feeling, we may want to chase it away. But it's more effective to return to our conscious breathing and just observe it, identifying silently to ourselves. Breathing in, I know there is an unpleasant feeling in me. Breathing out, I know there is an unpleasant feeling in me. Calling a feeling by its name, such as anger, fear, sorrow, or joy, helps us identify it clearly and recognize it more deeply. In the case of fear, you bring out your mindfulness. Look at your fear and recognize it as fear. It is best not to say, "Go away, fear, I do not like you. You're not me." It's much more effective to say, "Hello, my fear. How are you today?" I love that. It continues, "It's like a mother when the baby is crying. She picks up the baby and she holds the baby tenderly in her arms. Your pain, your anxiety is your baby. You have to take care of it. You have to go back to yourself, recognize the suffering in you, embrace the suffering, and you get the relief." Now granted, when dealing with serious trauma, it's not easy for our clients to develop this kind of perspective. It takes time and patience and often skillful intervention. But I think that helping our clients to cultivate an observing ego that can identify feelings without feeling overwhelmed by them is a very important part of the healing process. This is very consistent with recent developments in neurobiology and neuropsychiatry. Daniel Siegel, who is on the leading edge of this developing science, has developed techniques to help his clients cope with painful feelings and experiences. In one instance, which I have found helpful, he suggesting to a client, imagine that you're in a safe and warm glass bubble beneath the ocean. The chaos of feelings that have become overwhelming you are on the surface of the ocean, where there is a storm threatening and wildly crashing waves, maybe boats crashing. You can see all of this from your bubble, but you are in a safe space far enough beneath the surface where the water is calm and there is no threat. This observing ego then becomes an important tool, I think, when dealing with trauma, when learning with the help of various therapeutic techniques and interventions to realize that was then, but this is now, and they're not the same. I'm not in that traumatic moment anymore. It is there, but I'm here, and I am safe. I think Buddhist practice can be very helpful in developing the ability to separate the observing part of oneself from one's threatening memories and feelings in this way. I think the Buddha understood several thousand years ago what neuropsychiatrists are just beginning to understand today. Finally, a third way in which I think Buddhism is instructive to us when dealing with trauma, and has been very helpful to me, is the teaching that the separation between mind and body is an illusion. We often have the illusion that our feelings exist in our mind or in our brain. But I think really that couldn't be further from the truth. The brain is simply a receptor translating to us what is going on. Our feelings tend to reside totally in our bodies, which includes the mind. And in order to deal successfully with our feelings, we need to be more in touch with what's going on in our bodies. At the same time that neuroscience is teaching us about the many layers in the brain, I think somatic therapies, of which there are so many right now, are helping us to integrate soma and psyche, body and mind. This is an area which I'm only beginning to integrate more into my own practice, but I'm very grateful to what we're learning from these somatic therapies today. At PSI, our motto is treating mind and spirit as one. But in our practice, I think we need to expand that to treating body, mind, and spirit as one. Once again, Buddhist practice has been helpful to me in developing this awareness. When I do mindful breathing, I feel it in my entire body. Without this body, there would be no mind. And I think those who suffer from trauma often lose touch with what's going on in their bodies, which is where the troubling feelings reside and need to be addressed. So these are just some of the ways in which Buddhist thought and practice have been and continue to be helpful to me in working with those who suffer from